All right, so now we're going to talk about seizure disorders. Seizures can be caused by several things. They can be caused by infection, by a neurologic illness, by metabolic causes. People can have seizures for low blood sugar or because of electrolyte imbalances, things like that. They can be caused by trauma, and they can be caused by toxicity of certain substances. There are, we kind of like, one of the ways they classify seizures are by the cause or by why they're happening. So there are acute symptomatic seizures. That means a seizure that's due to an acute neurologic or other illness. So if a patient has meningitis and has a seizure, that is an acute symptomatic seizure. Okay, that seizure is because of an acute problem right now. A remote symptomatic seizure might be due to a previous neurologic injury. So a patient who has had maybe a submersion injury, maybe they've had a near drowning or had a drowning and survived that, and they have seizures because of the hypoxic brain injury. That's a remote symptomatic seizure. It is because of something that happened in the past. Cryptogenic seizures are unknown etiology. And idiopathic seizures are usually from a genetic reason. So there are people who just have a seizure disorder, and they have seizures for some reason. So the pathophysiology of seizures is that there are abnormal electrical discharges that begin somewhere in the brain, and they spread to adjacent neurons and eventually to other areas of the brain. And those abnormal electric discharges cause changes in level of consciousness, awareness, movement, and actions. Okay. We think of seizure as someone falls, they're unconscious. Think of a tonic-clonic seizure. They're jerking movements. That's very classic, right? That's only one type of seizure. There are seizures that cause other manifestations. And what makes it a seizure is if it's caused by these abnormal electrical discharges that spread to other neurons. So there are types of seizures. We're going to talk about, we've already talked about classifying seizures by the reason for them, the cause, but they're also classified by the type. So partial seizures, seizures can be partial or generalized. Partial seizures have a local onset and they involve a small location in the brain. So they only affect one part of the brain. A simple partial seizure causes localized symptoms, and they may be motor, they may be somatosensory. So the patient may have a sensation that's persistent in one place. Psychic, that person may have some sort of mental experience that happens over and over, or autonomic symptoms. Autonomic would have to do with maintaining blood pressure, heart rate, respiratory rate, those things. So those are simple partial seizure. They're localized. They usually cause a localized symptom of some kind. Simple partial seizures with sensory signs. The patient, rather than movement, they may feel numbness, tingling, prickling. A paresthesia is an abnormal sensation that doesn't have a physical visible cause or pain, and it may originate in one area and spread to other parts of the body. They may have visual sensations or images. They may have posturing or hypertonia, increased muscle tone. Complex partial seizures involve a period of altered behavior. The patient doesn't remember it. They cannot respond to their environment. They have impaired consciousness. They may have some kind of aura or sensory phenomena. They may have usually a stereotypic motor behavior that's the same with each seizure. So that's called an automatism. So like maybe when they're having a seizure, they're not responding to anything and they're moving just this arm. Okay, that's what a complex partial seizure would look like. They also have post-ictal drowsiness and confusion, which is not always seen with other types of partial seizures. Generalized seizures involve both hemispheres of the brain. The most common is tonic-clonic. This occurs usually without warning. There are patients who actually have an aura, but mostly this is without warning. The eyes roll upward, the patient loses consciousness, and they have generalized tonic contraction of all the muscles. They're apneic, they may have violent jerking, they may be incontinent, they may have post-ictal, they may have decreased level of consciousness, confusion, or poor coordination. So post-ictal is that period right after a seizure. Status epilepticus is when that patient is having seizures that are too close together to allow them to regain consciousness. They have a seizure, they don't ever wake up, they have another one. That can lead to exhaustion, respiratory failure, and death. Absent seizures is a brief loss of consciousness without a change in muscle tone. These are frequently unrecognized because they're just for a second or two. They just are suddenly, it's a lot of times they're mistaken for ignoring or being distracted. So they just kind of lose really brief bits of time, but it doesn't change the muscle tone. Atonic or akinetic seizures, the patient has a sudden loss of muscle tone and falls to the floor. They momentarily lose consciousness. So they're upright and then suddenly they are in the floor. Myoclonic seizures are sudden brief contraction of a muscle or a muscle group with no post-ictal state. Infantile spasms is when a child has numerous seizures during the day, but they don't have drowsiness afterward. It's associated with a lot of cognitive disabilities. Febrile seizures are when a child has simple or complex seizures, usually between the ages of 6 months and 5 years old with no neurologic abnormality. They have a complete recovery. They never have a seizure without a fever, and they have no neurologic illness. It's very important to understand for seizures to be classified as febrile seizure, it can only ever happen when they have a fever. So if they have a seizure without fever, that's not febrile. They can also have no neurologic illness, okay? And then they recover from that seizure completely. And then there are other unclassified types of seizures. Diagnosis of seizure. Sometimes it can be difficult to diagnose whether someone is having seizures or not and what type without visualizing them. We want to get a history of the suspected seizure activity. Sometimes it's helpful to ask the observer to mime the episode. Show me what that person looked like during the episode. There are some conditions that can look like seizure and be mistaken for seizure. Migraines, drug toxicities, syncope is just passing out, which may be from a cardiac issue. Breath holding spells when they get so upset and overwhelmed they lose their breath or can't catch their breath. Movement disorders like tics, cardiac dysrhythmias that can cause sudden loss of consciousness, sleep disturbances. Psychogenic seizures are when there are seizure symptoms with no EKG changes, rage attacks, and TIAs. We also want to assess family history. Does anyone else in the family have any have a seizure disorder or have any behaviors that could look like a seizure? That child needs a complete physical and neuro assessment. An EEG can confirm the presence of an abnormal electrical discharge, but if this patient is not having seizure at the time, then an EEG doesn't give us any information. So, or doesn't give information about the seizures. It might give information about other things that are going on that may be connected. But typically patients who have a seizure disorder will have a normal EEG when they're not seizing. So sometimes they try to provoke seizure activity to be able to catch it on the EEG. And one of the ways to do that is a sleep deprived EEG. They may have a parent keep the child awake all night long, go in the morning for an EEG to see if they have any seizure activity. And then once seizures are confirmed, then further testing may need to be done to determine the cause of seizures. We'll come back in the next section and talk about seizure management.